Hello dear students, welcome back to my YouTube channel Physiology Learning. So we are discussing the part 2 of cardiovascular system. In the previous video we have discussed about the jugular venous pulse. In this video we are going to discuss about the local and systemic cardiovascular regulatory mechanisms. Of course, blood pressure regulation and cardiac output regulation we will study it separately, but this video will give you an overview of what are all the effects various places like the local control and systemic control that is happening with respect to the cardiovascular system and how it is being regulated. So this is an overview. Sometimes in the examiner they ask question like in the theory paper like local and systemic control, you can use the help of this video and write under these subheadings. So let's get into the topic, local and systemic cardiovascular regulatory mechanisms. So first, it is basically divided into the neural control, wherein the neurons will control both the cardiovascular, means we are talking about the heart as well as the blood vessels. Then the local regulation, how it is regulating the local blood flow. Then substance secreted by the endothelium. The endothelium is considered sometimes as an endocrine organ itself. It secretes a lots of substances. And systemic regulation of neurohumoral substances. So here it is going to produced by the nerve and it is going to the circulate in the blood. So that is why it is named as neurohumoral agents, circulate in blood. So first, the neural control. We will study the neural control under various headings. So first, coming to the neural control. What is the effect of neural control on the blood vessels? So all of us know neural control with respect to the cardiovascular system is done by the autonomic nervous system. And it has two divisions which all of you might be familiar. That one is sympathetic, another one is parasympathetic. ANS as such we will do separate videos, but it is having two divisions. One is sympathetic and parasympathetic. Sympathetic means whenever you are in a stress or you are in any emergency situation, then the sympathetic activity will kick in. And if you are in a relaxed state, the parasympathetic activity will kick in better. What is the effect of sympathetic and parasympathetic system on the blood vessels? So the sympathetic system will act on the blood vessels in different receptors. First thing is, whenever it is acting on the alpha receptors, it has two types of receptors. One is alpha and the other one is beta. What happens is most of the postganglionic neurons, they will release norepinephrine. NE is norepinephrine, which is a sympathetic neurotransmitter. They will act on the alpha-1 receptors and cause vasoconstriction. So they will cause vasoconstriction and increase the blood pressure of the person. In a similar way, sometimes the exercise, whenever a person is exercising, the epinephrine which is released from the medulla, so the norepinephrine is generally released from the neurons, they will act on the beta cells. They will act on the beta cells and they will cause vasodilation. Why we need two different types of activity is because whenever a person is exercising, the exercising muscle should receive vasodilation and should receive the more and more blood flow. Whereas the other parts, they can go for vasoconstriction and redistribute the blood wherever it is needed. Suppose you are working out in a gym and whichever muscle is needing the blood flow, there the vasodilatation will happen and the rest of the body can go for vasoconstriction and send the blood supply to there. Then we have another one group of response which is called as sympathetic cholinergic fibers. Here the fibers are sympathetic but their neurotransmitter released is acetylcholine. And all of you know that acetylcholine is a parasympathetic neurotransmitter. But there are some fibers which are sympathetic cholinergic which will cause vasodilation. And these fibers are present in skeletal muscle and they will help in vasodilating the skeletal muscles. So these are the effects on blood vessels. What is the role of parasympathetic system on the blood vessels? The parasympathetic system, the innervation is not at all present in the blood vessels, so the action is nil. So parasympathetic system as such does not act on the blood vessels. Of course, it acts on the heart, but it does not act on the blood vessels much. So the action is almost nil. Then both the vasoconstriction and the vasodilatation part is done by the sympathetic system. Now let's talk about the effects on heart. All of us have discussed, we have already discussed in our previous videos itself, the innervation of the heart, that ANS will innervate the sympathetic system and parasympathetic system. And we have the beta-1 receptors on the heart, which is going to be present in the SA node, AV node, bundle of his, Purkinje, as well as the atrial and ventricular muscle. This is very important. There is huge amount of innervation of sympathetic fibers on the ventricle. Whereas when you talk about the parasympathetic fibers, here it will act on the muscarinic receptors and it will act on SA node, AV node, and some fibers are still present in the atria, but we have not mentioned the ventricle. So generally, the parasympathetic system has a major influence on the heart rate rather than the force of contraction. Force of contraction can be majorly influenced by the sympathetic fibers. So whenever sympathetic system is activated, we have already studied all these effects. There is an increase in inotropy, force of contraction, chronotropy, increase in heart rate, and dromotropy, increase in the conduction rate. So all this will increase, whereas parasympathetic does the exact opposite of it. So this is the effect of both the autonomic neural control on the heart. First we have seen the blood vessels, now we are done with the effect on heart. Then there are some central neural regulators also, which are present in the brainstem region. And they are the decision makers in the house. So what they will do is, they will analyze the heart rate, stroke volume and vessel diameters of a person, and they will assess and have sensors in multiple places. And these sensors will give the information, and one of them example is baroreceptors, which will give the information to the brainstem. And this brainstem will again decide and act upon and regulate the end result, that is the blood pressure control. Don't worry, this again we will study in BP regulation. In BP regulation, we will study in detail about the baroreceptors, chemoreceptors and everything. So central neural control, just remember there is an area in the brainstem which acts on and can control the cardiovascular system. So baroreceptor, chemoreceptor, all this will be studied in detail in the blood pressure regulation. Then there are other type of receptors which are called as atrial stretch receptors. And they are also called as cardiopulmonary receptors. Some of them are present in the pulmonary system also, that is the pulmonary artery node. So this atrial stretch receptors and cardiopulmonary receptors also play a role in the local and systemic control. So what do they do? As you can understand here, the word stretch is used. So whenever there is a stretch on the atria, these receptors are going to be activated. When there will be more stretch on the atria has to expand. When the atria will expand, whenever the blood volume increases, whenever there is an increase in blood volume, somehow some reflex is happening and the blood volume has increased. So this is not good for the heart, because too much of blood volume will cause derangement and failure also. So to prevent this, it has a backup mechanism by activating some of the receptors. It has two receptors, that is a type A and type B, and both of them are volume sensors. So they are going to sense the volume, and type A is going to act during atrial systole and type B is going to act during diastole part. So what happens once there is a stretch in the atria, the volume is going to be stretched and they are going to produce a substance which is called as atrial natriuretic peptide. This is called as atrial natriuretic peptide. Natriuresis means the sodium as well as water is going to go into the urine. Natriuretic peptide. So the sodium as well as water, both of them will be sent out into the urine. So it is going to cause the more and more urination. So naturally there will be a decrease in volume. So this increased volume will increase the urinary output with the help of this neurotransmitter atrial natriuretic peptide, and they will reduce the volume. So this stretch receptors are present in the centrally in the heart and they will control it. And there are some receptors in the ventricle also. Whenever they are distended, the heart rate is going to decrease and they are going to decrease the blood pressure. The reason behind this is not known. So basically the response is seen that there is a decrease in heart rate and a decrease in blood pressure. And there are some receptors which are called as chemosensitive receptors. So as you can understand from the term, chemo means chemicals. So these receptors are sensitive to the chemicals. So what type of chemicals? Like capsaicin, serotonin and phenylbiguanide. These are the chemicals which they are injected in experimental animals and understood that they are activating these receptors. But does it happen naturally? Yes, it sometimes happen naturally in humans, not naturally, it's due to some injury. So whenever there is a myocardial infarction and they are planned for thrombolysis. So the thrombolysis is planned, and after that what will happen? The blood will go and reperfuse because the clot now which was obstructing, that was taken, that was lysed and it was removed. So the blood flow is re-established. All of us think that this is a very good thing to happen because now the blood flow to the injured area is re-established. But sometimes this reperfusion, if it is done, especially after a longer duration, the patient has come to you after several hours, like maybe after 24 or 48 hours, what will happen? Whenever we are trying to reperfuse it, this tissue was already injured and this tissue was producing reactive oxygen species, which is a free radical. Now what we have done is, and this tissue is in a much preponderance to produce free radicals. Previously, because of the block, the oxygen supply was less. Now what is happening is the injured tissue is getting increased oxygen now. So what it is going to do, it is going to produce more and more free radicals, which is actually dangerous. It is actually dangerous to the person. So that is why the timing is very important. Be it a stroke where there is a block in the blood vessels of the brain, or a myocardial infarction which needs thrombolysis, until unless the patient comes to the emergency at an earlier stage, then doing a thrombolysis might be harmful also. Might not be helpful, but sometimes it can be harmful also because of reperfusion injury, wherein more and more oxygen is supplied to the burning fuel. The fuel is burning and you are putting petrol to it, because now the oxygen is the one which is giving the free radicals, more and more free radicals. And the person will have a response. What type of response he will have is, he will have bradycardia. His heart rate is going to come down, and he will have hypotension, and he will have a breathlessness phase which is called as apnea. So his breathing is also stopped. So all this, there is a specific name for this reflex. You can comment in the comment box, what is this reflex whenever a myocardial reperfusion injury is happening. So this reflex, if you comment in the comments box, I'll be happy to pin the right answer in the comment box. So these are the regulators in the neural control. Now coming to the local regulation. This local regulation is present in almost all the organs, be it kidney, be it brain, be it the skin, all the main organs, they will have a local control. So what is the advantage of this is, they will control their blood flow according to the local environment. Suppose if the heart is needing more and more blood, it will control its own blood supply according to its local metabolites which are produced. And that is a form of auto-regulation. And there are two theories for it. One is called as myogenic theory, another one is metabolic theory. What is this myogenic theory? So whenever the blood vessel becomes stretched too much because of the increased pressure, suppose there is a blood vessel, now this blood vessel is stretched too much because of the increase in BP. We don't want it to happen because this stretches too much and the blood pressure is so high. So what it will do is, the blood vessel will contract again and push the blood and decrease the blood BP. So how this is happening is, so whenever it is stretched, it is going to activate some of the stretch sensitive calcium channels. This type of calcium channels are called as stretch sensitive calcium channel. And again it is going to contract back and bring its own volume. So this type of response which is done by the musculature, that is why it's called myogenic response. Next, coming to the metabolic response. Metabolic response, as all of you can understand, that there are some metabolites which are being produced. So whenever there is a need, there will be production of vasodilators. Suppose the muscle is under heavy workout or being exercised, especially suppose the heart, you are running, your heart naturally needs to pump more blood. So ultimately it has to supply itself with more blood, because right now it is also working hard. So naturally it has to vasodilate its own blood supply and increase the blood flow. So whenever there is a decrease in oxygen, decrease in pH, increase in temperature, increase in K plus, increase in lactate, all of them will be happening whenever you are exercising. So if you imagine, all of this activity will be happening when you are exercising. Naturally, all this metabolites is going to increase the demand and they are going to cause vasodilatation, which is going to perfuse it. So this autoregulation you can write in all the questions of special circulation. There will be regional circulation, we will be discussing in the further videos. There you can write both these mechanisms because this happens in almost all the organs which undergo local control. Then some of the vasoconstrictors are also there. One of the example is serotonin or the reverse condition. If all of this becomes opposite, increase in oxygen, increase in pH, decrease in the temperature, or decrease in K plus, or decrease in lactate. So all of them can stimulate vasoconstriction. So this is all about the local regulation. Now coming to the endothelial substances. The endothelium inside the blood vessel, suppose there is a blood vessel, the innermost layer is the endothelium. This endothelium is sometimes considered as an endocrine organ itself. Endocrine organ itself. Why it is considered as an endocrine organ itself is because it is going to produce humongous amount of local metabolites, hormones and everything. That is why it is considered as an endocrine organ. So let's try to understand a few of them. It can produce prostacyclins, which can inhibit the platelet aggregation and cause vasodilatation. It can produce another vasodilator, that is the nitric oxide. The nitric oxide were previously called endothelin derived relaxing factor, which is called as EDRF. Initially, they identified some factor which is causing vasodilatation, relaxation of the smooth muscle. So they named it as endothelial derived relaxing factor. But after that, they identified that that component is nothing but NO. That is why now the NO term is used, not the EDRF, because initial name was endothelium derived relaxing factor. Then carbon monoxide, which will also cause vasodilation. Then endothelin, there is a substance called endothelin, which is a powerful vasoconstrictor by itself. So this is again important. This endothelin and NO are the two important components produced by the endothelium. Let's discuss a little more about this endothelial derived relaxing factor or NO, because clinically this can cause vasodilation. So in a person of maybe myocardial infarction and we have to dilate his blood vessels, so this can be given depending on the situation. So this arginine is a neurotransmitter. Arginine. So this arginine is an amino acid which is getting converted into NOS, that is the nitric oxide. So how this nitric oxide is formed? This arginine, which is an amino acid, under the influence of nitric oxide synthase, it will form nitric oxide. This nitric oxide synthase, now they have identified multiple variants of it. NOS 1, 2 and 3. 1 is from the central nervous system, 2 is from the macrophage and 3 is from the endothelium itself. Then NO1 and 3, they are generally activated by increased calcium levels, ACH and bradykinin. That is because the components like NOS, they are being released and they will cause vasodilatation by the production of nitric oxide. So what is the mechanism of action? The mechanism of action is simple. It activates guanyl cyclase, which relaxes vascular smoothness. And sometimes it can be used as a prevention for hypertension. Why? Because in hypertension, the blood vessel is not properly relaxing. It is in a rigid state. So when NO is acting on the blood vessels, there is slight relaxation of this vascular smooth muscle, which can be used to reduce the blood pressure. It is also used in vascular remodeling and angiogenesis. And for a patient with angina, wherever there is a block, so we can do a mild vasodilatation with the help of nitroglycerin or nitrovasodilators. And nowadays they have also identified that NO has some antimicrobial role. So NO itself can be as a short note, so you can go through this. Now coming to the systemic regulation by neurohumoral agents. So these are substances which are produced by the neurons and they are circulating in the blood and they will cause the action. A few of it we will discuss. The kinins, especially the bradykinin and kallidin. They have a dual action. How they will act is, they will contract the visceral smooth muscles. They will contract the visceral smooth muscles and cause the contraction. Whereas vascular smooth muscles, it is going to relax. How they are doing it is, the receptors in both this group is different. So this vascular smooth muscle relaxation will increase the blood flow during an injury. Their action is said to be very similar to that of histamine in case of the blood vessel. Histamine also causes vasodilatation to increase the local blood flow. And we have some of the natriuretic hormones, especially the ANP, BNP and CNP. Atrial natriuretic peptide, brain derived natriuretic peptide and C-type natriuretic peptide. They are all responding to hypervolemia. Already we saw that whenever the blood volume is increased in the atria, the ANP is going to be produced and they will reduce the blood volume by causing diuresis. And there are some vasoconstrictors which are circulating in the blood, especially the vasopressin, Ne, angiotensin 2 and urotensin. So these are the local control mechanisms. So there are some neural control directly in the parasympathetic and sympathetic system, and we have the local control, that is the myogenic response and the metabolic response, and we have the endothelial substances production, and finally the systemic regulation by neurohumoral agents. So this is just an overview of local and the systemic regulation of the cardiovascular system. But specifically, we are going to study about blood pressure regulation and cardiac output regulation in the coming videos. So stay tuned for further videos. If you have any doubts, you can put it in the comment section. And the triad which we have asked, you can also drop it in the comment section. What type of reflex is this whenever there is a reperfusion injury which is happening? So thank you for watching the video. We'll see you in the next video. Thank you so much.